Hi, I'm Silvia Scaglione. I'm the coordinator of the B2B project. Within the B2B From Breast to Bone project, we are developing technologies for supporting biomedical research, adopting recent advantages in fluid tissue culture system and 3D bioprinting. B2B was inspired by the difficulties and experimental limitations that the biomedical researchers have to face day to day. And as a bioengineer, I wanted to develop a technology that responded to their need, a technology helping the science. In cancer field, scientists are missing reliable tumor model to advance their research. This discontent is generally related to the fault of available in vitro and animal approaches. Standard in vitro models are usually bidimensional and miniaturized, so they are unable to capture the three-dimensionality and the complexity of living organs. But the three features play an essential role in cancer development and its spontaneous formation of metastases involving the passage from one tumor to another fluidically connected organ. On the other hand, in animal models, the human-derived cancer is surrounded by a non-human physiological system, which of course can impair the reliability of the result. To overcome this, we want to develop an in vitro alternative, more clinically relevant than the available in vitro models, and that is specifically conceived to study the spontaneous metastatic process.
The B2B device hosts two organoids connected by a fluidic system to study the breast cancer metastasis to the bone. The process begins in the breast chamber, where cancer cells multiply while vascular cells form a micro-network of capillaries. Within this growing mass, the migration of cancer cells to the bloodstream happens spontaneously. The capillary network connects with an external macro network of bioprinted tubes covered with endothelial cells. Once they join, some tumor cells enter the synthetic tube and, following the circulation, they travel towards the bone chamber. Here, the cancer cells leave the circulation and start to colonize the bone marrow, thus completing the metastatic process. The B2B device is specifically designed to study the behavior of cancer cells during their journey and to discover factors that favor or hinder their migration.
The connection via a fluidic system is particularly critical in B2B. It will use a macro to micro bioprinted vessel that should reproduce the different sizes, branching, and features of the blood vessels. And at the same time, they should be directly connected to the self-assembled capillaries from the tissues. And as a first application, we have selected the metastatic process of breast cancer to the bone, since it still represents a major hurdle. Breast cancer is the most common in women worldwide, and its most common metastatic site is indeed the bone. In B2B project, we will connect a patient-derived breast cancer lesion to an in vitro reconstructed ossicle. However, the technology developed in B2B project is versatile, and it might be applied in the future to study other types of cancer with similar features. I believe B2B will lead to significant advancements in breast metastatic cancer knowledge, finally boosting also the new drug development.